Hi, this is Nab from the Opioid Data Lab at the University of North Carolina in Chapel Hill. This week, the Foundation for Opioid Response Efforts announced we've been awarded a grant to study street drugs, so I'm going to fill you in on what we're going to do. Street drugs in the United States have grown unpredictable and treacherous in the past couple of years, more so than ever before. So in 2020, we started testing drug samples to figure out what's actually in them. Working with community-based harm reduction programs, we've learned so much about the local drug supply. We've been able to help doctors treating patients with weird side effects in hospitals and warn syringe exchange participants when dangerous cuts show up. So how do we do this? Forensic chemistry has been used as evidence in court for drug cases for decades, but it's time for us in public health to use the same technology to prevent harm. However, the problem is, nationwide, there are only a handful of drug checking programs oriented towards public health. We need more harm reduction programs on the ground providing this service. That's happening organically, but it will take some time. But here's the other part of the solution. Every large university already has the machines needed for analytical chemistry. They get used for materials science, environmental toxicology, and nanotechnology every day. So we thought it would be easy to use these machines to test street drugs. But street drugs are different. It turns out it's a good bit more complicated than putting a drug sample in a machine and getting a full inventory of what's in there. We were getting results, but they took time, and we were reinventing things, making mistakes. And we were seeing new psychoactive substances that were easy to miss without prior knowledge. That's where this new funding is really helpful. The end goal is to release public protocols and methods so that other university labs can work with harm reduction programs to provide timely information back to people who use drugs. And sure, it can be used for research too. Over the next 2 years, we will document all our decisions, from small ones like time and temperature settings to bigger questions about ethics and anonymity of data. Why do we need to do this? Well, the existing protocols from crime labs focus just on the controlled substance. For public health, we also need to know about the dangerous cuts and fillers, whether the drugs have mold, and what new trends are emerging. These lab methods and statistical methods haven't been developed yet. So that's our mission, to find ways to make drug checking useful for public health, to provide the tools to scale this intervention nationally. We'll be posting everything at opioiddata.org, so bookmark that page to keep abreast of all our free materials. The second part of this project will be to advance how we communicate drug alerts. Drug alerts are critical to reduce harm and death, right? We'll take a page from the advertising playbook to establish best practices for designing drug alerts that will grab your attention without making you panic. We will minimize risk-seeking and provide actionable information. This will be all in the form of templates that other organizations can use when issuing their own drug alerts. We'll be discussing all of that in another video. By pairing novel chemistry with cutting-edge communication science, we offer a comprehensive solution. These techniques empower people who use drugs to make informed decisions about what they put in their bodies and reduce the most devastating physical harms. It's time for new solutions.